everyone. Welcome to this session on metabolic syndrome. Metabolic syndrome is also known as the deadly quartet. It is defined as a set of risk factors which act synergistically to increase your risk for cardiovascular disease, stroke, and type 2 diabetes. These risk factors include central obesity, dyslipidemia, hypertension, and hyperglycemia. How is metabolic syndrome diagnosed? Well, it is defined by abnormal obesity or visceral obesity that, according to the International Diabetes Federation, is classified as a waistline of over 94 centimeters for European males or over 90 centimeters for non-European males, or a waistline over 80 centimeters for women. In addition, to be classified as someone with metabolic syndrome, you must have two or more of the following factors, which include elevated triglycerides greater than 1.7 millimolar, low high-density lipoprotein cholesterol, which is defined as less than 0.5 millimolars for males and less than 1.3 millimolars for females. Hypertension, which is defined as blood pressure over 130 systolic and over 85 diastolic. And hyperglycemia, which is defined as over 5.6 millimolars for your fasting plasma glucose. Now, in terms of the clinical consequences of metabolic syndrome, there are many numerous clinical complications ranging from the heart to blood vessels to the liver to poor gum health. So some of these ones include poor wound healing, periodontal gum disease, fatty liver disease, arthromatous plaque or atherosclerosis, which may then lead to cardiovascular disease, myocardial infarction. Additionally, people with metabolic syndrome may experience symptoms such as locomotor problems, brain and nerve issues, and even have fertility and maternal fetal problems. Now, how do we treat this condition? Well, as we know, metabolic syndrome is characterized by high blood sugar levels, which may be diagnosed as type 2 diabetes. So you can treat this with metformin, which is a drug that inhibits hepatic glucose production. You can treat this with liraglutide. As we all know, a big risk factor is central obesity, and liraglutide is actually an appetite suppressor that feeds back on the hypothalamus and slows gastric emptying, helping you to feel more full so you eat less and gain weight slower. Now, of course, another way to counteract the central obesity and metabolic syndrome is to have rapid weight loss through very low-calorie diets. In the past, there have been many myths suggesting that weight loss should be achieved over the long term. However, in the short term, weight loss in many studies was shown to be just as effective and in many cases more achievable. The same percentage of people maintained their weight loss compared to the long-term weight loss groups. In terms of prevention of metabolic syndrome, you can reduce your cholesterol intake, you can reduce your salt intake, you can reduce your alcohol intake to less than 2 standard drinks per day. In fact, having 2 standard drinks per day may actually have a lower risk for metabolic syndrome than having no drinks per day. You can increase your physical activity to at least 30 minutes per day, stop smoking, and again, walking faster was shown to reduce diabetes risk. Having a healthy microbiota is also very important for ensuring weight loss. In many cases, having a healthy microbiota or gut colonization by these healthy bacteria was shown to be just as effective as cholesterol-reducing drugs. Now, we are going to talk about how metabolic syndrome is so deadly and what makes it so deadly in terms of its pathology. So first of all, a characteristic of metabolic syndrome is dyslipidemia. Now, dyslipidemia is characterized by several actions in the storage pathways for fat. So in dyslipidemia, you have a low amount of VLDL, IDL, and LDL. These lipoproteins all assist in all contribute to fat being stored in the foamy macrophages and accumulating in adipose tissue, muscle, and adrenal glands. This is not a desirable consequence. Cholesterol, triglycerides, and fatty acids in the blood are very bad because they lead to atherosclerosis. And additionally, when they're in the muscles and glands, they actually induce, these fat actually releases adipokines, which are cytokines released by adipose tissue that promote insulin resistance. Additionally, in dyslipidemia, there is a low amount of HDL, or high-density lipoprotein. High-density lipoprotein plays a vital role in reverse cholesterol transports, collecting all the dietary fat which has accumulated in the macrophages and in the blood back into the liver again for storage. This prevents atherosclerosis or the formation of atheromatous plaques by foamy macrophages. In dyslipidemia, a big factor is also the diet, because the more dietary fat you consume, the more it is broken down into bile. And the more that is broken down into bile, the more triglycerides you have being transported as chylomicrons via the lymphatic system into these glands and muscles and adipose tissue again, which we learned, as previously mentioned, is bad because they secrete adipokines and promote the secretion of further free fatty acids that increase your risk for diseases such as atherosclerosis, cardiovascular disease, and the complications from there onwards. Additionally, dyslipidemia, it causes hyperlipidemia, which is a high amount of lipid in your blood. As we all know, another characteristic of dyslipidemia is that you may have extra adipose tissue. Having extra adipose tissue releases adipokines, which increase your normal tissue's resistance to insulin and impairs the function to store glucose. This level of insulin resistance allows for hypoglycemia. Now, hypoglycemia together with hyperlipidemia contribute to oxidative stress, hypoxia, and advanced glycation end products within the vessels. This increases smooth muscle proliferation at the arterioles, also known as hyaline atherosclerosis. In other words, organs which are rich in arterioles will sustain more damage. Additionally, the combined effects of oxidative stress, hypoxia, and advanced glycation end products trigger inflammation signaling cascades, which then activate pro-inflammatory cytokines. This means that organs rich in arterioles will sustain inflammation. Examples of these include the kidneys, the brain, and the eyes. So they may have nephropathy, neuropathy, and retinopathy. So these are actually some of the most common symptoms experienced by diabetic patients. Additionally, you have hypertension occurring as well in metabolic syndrome. Now, this hypertension is known as a primary hypertension as opposed to secondary because there is no identifiable cause and it is often due to a combination of causes. It is also chronic, which means it is over the long term and not in the case of a hypertensive crisis, which arises immediately. And hypertension, again, it causes lots of damage in terms of the blood vessels because there is more force needed to ensure that flow. And when it's high blood pressure, you can get aortic stenosis, aortic myocardial infarction, and in other times you can cause endothelial damage and hyperfusion of erectile tissues, which leads to sexual dysfunction. Hypoperfusion, so that means not enough blood gets into these erectile tissues. Additionally, you can have not enough blood flowing to your kidneys or chronic ischemia, which can lead to atrophy and even more complicated causes. You can have hemorrhages and aneurysms occurring in the brain, which can lead to vascular dementia. You can also have arteriosclerosis in the eyes, which leads to retinal damage. This is why in diabetics diabetic retinopathy is the leading cause of blindness, and nephropathy is also the leading cause of end-stage renal disease, while neuropathy, not just the brain but the nerves as well. In diabetics, it's also the leading cause of lower extremity complications. Okay, now let's return back to our graph, and we can see that hyperinsulinemia also affects sex hormones, particularly increasing the levels of estrogen, ovarian androgen, and decreasing the amount of SHBG production. All of this in the end affects fertility and has an influence on maternal and fetal health. Additionally, hyperinsulinemia via IGF by increasing the bioavailability of IGF-1 in the blood can also trigger increased cell proliferation in the target cell and decrease apoptosis. The end result of increased cell proliferation is neoplasia, which may develop into invasive cancers. Now, we're going to look at some of the consequences in more detail, seeing as we have understood the pathogenesis of metabolic syndrome in more detail. First, we're going to look at atherosclerosis. So atherosclerosis is the buildup of fatty plaque inside arteries. We can see here that the artery starts off as normal and free-flowing. However, over time, due to lipid accumulation, endothelial dysfunction, monocyte adhesion, and it leads to fibrofatty plaque. This then progresses to advanced plaque with more calcification and plaque remodeling. When this happens, you reach the clinical horizon in which dramatic symptoms such as myocardial infarctions may appear. If you don't intervene at this stage, then the advanced plaque can rupture and cause an aneurysm. you can occlude by thrombosis, or you can have critical stenosis. And when this happens, we see all these conditions such as retinopathy, neuropathy, and nephropathy happen. So in this lead time, this is very important to note. Between the normal artery to the advanced plaque, that's when you have reversible injury and angina, and symptoms such as angina, which are silent and often ignored. However, if you're careful and you take the steps to prevent it, then you may be able to prevent the clinical phase of metabolic syndrome. Okay, revisiting some of these consequences now that they make more sense. So you have poor wound healing, and this is due to several reasons. Number one, you have hyperglycemia, which means that there are lots of nutrients for the microorganisms. Number two, you have neuropathy and decreased sensation in your distal limbs as a result of the inflammation that takes place, damaging nerves, and this is caused by a mix of hyperglycemia, hyperlipidemia. So the poor nerve sensation means that when you get injured, you are not aware of what's happening quite as quickly. And then you have periodontal gum disease. So this is very common as well. You may have inflamed gums, which are red and swollen, and you may even have tooth decay. Then there is fatty liver disease, which again is the result of a increased a fatty diet and increased VDL and IDL levels, causing a poor fat regulation, and this will be worsened if you take alcohol and have an excessive nutrition intake. Arthromatous plaque, which we have already discussed, so that overall reduces the vessel elasticity and the risk for thrombosis, which leads to things such as fatty liver disease, because you might clog the bile ducts. Lastly, we have locomotor problems due to nerve damage, and just the increased body weight makes it hard to move around. Fertility and maternal fetal problems, which we have discussed, is as a result of impacts on the insulin sex hormone axis, and that's about all. So all in all, metabolic syndrome is a very complicated condition, and it is a complex condition which has very deadly risk factors that act synergistically to create a deadly impact for the patient. As a student or as a young person, we should be doing our best to ensure we get the right amount of physical activity and the correct nutrition every day to prevent all of these deadly consequences and the massive health burden metabolic syndrome has placed on our society. Thank you.